What are the biggest gaps in healthcare for queer folks?
Some of the biggest gaps in healthcare for queer individuals is just around data, right? We don't collect data in systematic ways. We don't use the data that we collect, and unfortunately, there's a disconnect. A lot of clinicians are afraid to ask questions about sexual orientation, gender identity, and patients, they want to be asked. We just don't have a place to document these things. We have to have better clinical standards for documentation. We have to have better documentation support so that when we get the information, we can actually use it. Because what I tell my patients is that your identity matters. Healthcare is different if you are LGBTQ+, and the only way that we can deliver the right care for the right patient is by having that information in a way that's actionable and lets us integrate it into the care delivery process.
What are the biggest gaps in healthcare for queer folks?
There are many gaps for queer folks. I think the biggest gap is digital tools that really provide opportunities to collect and use the information that helps a provider really provide the level of care that somebody that's queer identified needs to have. So an example of that is being able to collect sexual orientation and gender identity in a way that helps facilitate the best care and coordinated care as possible. If a provider doesn't know somebody's gender pronouns, for example, or gender identity, often that can limit the level of care that they're providing.